Hi everyone, good afternoon. Welcome again to another episode of Doctors Go Live on Columbia Asia Facebook. So today we will be discussing the topic that is not commonly heard of. It's actually about eyelids. We've got with us the General Ophthalmologist and Oculoplastic Surgeon from Columbia Asia Hospital Miri, Professor Dr. Chua Chung Nen. And Dr. Chua will be talking about Dr. Chua will be talking about droopy eyelids. Yes, that's the specific topic for today. So hello, Prof. Chua or Dr. Chua, how shall I address you?
Wow, call me Dr. Chua, it's easier.
Dr. Chua, okay. So everything good with you today, this afternoon?
Yes.
Thank you
very much for inviting me.
No problem at all. Okay, we're just going to go straight down to business now. We're going to be talking about droopy eyelids. Why is this particularly important?
Well, it's important because it not only affects the way people perceive you, but it can affect vision, especially in children. If you have droopy eyelid, it actually stop the eye from developing properly. And later on, as you can see, there are other conditions that can also give rise to droopy eyelid. Some of them can be life-threatening.
Okay, yes, that's very worrying. It's not just aesthetics then, not just about the looks.
Absolutely.
Okay. So let's take a look at your slides. I understand that you've got something to show. Okay, I'll let you introduce this part.
Okay, thank you very much. My name is Dr. Chua. I train in the UK and I subspecialize in eyelid surgery. Medical term is Oculoplastic. In this talk, I'm going to talk about droopy eyelid. And I'm going to tell you why it's important, what are the causes of droopy eyelid, and what are the different ways of correcting droopy eyelid. Why is it important? First of all, it's aesthetic, of course. If you have droopy eyelid, it won't look so nice, especially if it's a lopsided look, one eye big, one eye small. Then there's functional cause, then there's life-threatening conditions. As I mentioned just now, aesthetic, lopsided look, and then it can make a person look old and tired. Here's some picture of before and after eyelid surgery corrections. On your left-hand side, you can see a patient with droopy eyelid. That's because he has been wearing contact lenses over the years. And it's obviously a very lopsided look. So I did corrections to balance both eyes. And the one on your right is a patient with droopy eyelid on both sides. He was born with like that and obviously not happy with his appearance. And he think that he has been passed off for promotion because of his look. And then I did some operations to balance the two eyes and make him look more energetic. Then in elder patients, if you have droopy eyelid,
no, you were mentioning about that earlier picture. That patient was wearing contact lenses, and that caused him to have droopy eyelids. How is that possible that wearing contact lenses can cause droopy eyelids?
The thing is that foreign bodies, contact lens is a foreign body. You have it inside the eye. The eyelid will be rubbing on it. Actually, a study found that about 10% of patients wearing contact lenses for more than 10 years, 10% of them will develop droopy eyelid to a certain degree. Some of them very obvious, some not so obvious. Actually, in young patients who develop droopy eyelid later on, contact lens is probably one of the most common cause.
Does that depend on how someone cares for their contact lenses, or is that because of, or you were saying because of the friction, is it?
Yeah, it's because of the friction, yes. Because the muscle that open the eyelid is constantly rubbing against the contact lens. Depending how strong your muscle is, some of the people, the muscle is not so strong. So after years of rubbing, the muscle can become detached. And then you develop droopy eyelid.
I see. Okay. So is it safe to say that maybe the longer you wear contact lenses, the higher the risk of developing droopy eyelids?
Yes. It's related to how long you wear the contact lenses. I mean, over the years.
I see. For example, this patient, how long was he wearing contact lenses?
This guy is about 29 years old. He's been wearing it since he was about 16. So more than 10 years.
Yeah, but after correction, it looks very good.
Yeah, yeah. But we do advise them right after the operations, don't wear the
Mm.
contact lens for about 1 week. So that there's enough time for the muscle to become stronger before they put back the contact lens. Otherwise, if they go back to wear contact lens, we worry that the eyelid may droop again. Yeah.
So they can wear, if they want to, their contact lenses again after surgery.
Normally, we tell them, if possible, don't wear contact lens again because there's a chance it may droop. But of course, most people would prefer to wear contact lens. But if it droop again, it can be corrected again.
Okay, but you can do LASIK surgery also. They can do.
I don't do
They
it
can.
myself. It can be done. Yes.
Yeah, they can have it done, and it
Yes.
won't contribute to. There's no danger lah after
No.
having done the surgery. Okay.
No.
All right.
No. But if
Okay.
you have droopy eyelid, we prefer to correct the droopy eyelid first before you do the LASIK because the eyelid can cause astigmatism and all that. So droopy eyelid corrected, only then you do the LASIK. Okay.
Oh, you mean okay? Droopy eyelids.
Yeah,
Sorry,
because
doctor.
when you have the eyelid touching the eye, it
Mm.
actually can induce astigmatism. That's why some people, after correction of the droopy eyelid, they may find that their glasses need changing.
Yeah. So droopy eyelids, it's not just about aesthetic. It's not about making you look different, but it's also about it
It
interferes
can
with your
affect the
vision.
vision. Yes. Depending how severe, but more or less it's going to affect the vision.
Okay, yeah. The vision, what I mean is, yes, of course, because half your eye is closed, so of course it would affect the vision. But
Yes.
let's say that particular eye, is it a good eye has uh that has something blocking it, which is the eyelid, of course, or is it that the eye itself is damaged because of
No,
the
the
droopy
eye is
eyelid?
not damaged. This one is an adult, so the vision will not be affected. I mean, the vision will still be okay once you correct the droopy eyelid. Not like in children's, because there's certain period of time when the eye develop, which are critical. Then you need to make sure they can see well. But in adult, even if the eyelid drop down and cover the vision, once you lift it up, they can see okay again.
All right. Okay, we're clear.
Yeah.
Sorry,
Yeah,
doctor. So many
yeah,
questions.
no problem. It's nice to clarify some of the things I mentioned. And then in the elderly, if you have excess skin or because of muscle becoming weak, then you can get droopy eyelid. Obviously, this will cover the visions and make it very difficult for them to walk. Then there's functional, can block the visions, as I mentioned earlier, these two patients. And of course, in children, because when they are young, the vision development is quite critical during the first few years of life. So it's important if the eyelid cover the pupil and block the vision that the droopy eyelid should be corrected early.
So,
And there are some life-threatening conditions which can give rise to droopy eyelid. Some of them, such as cancer of the eyelid, can cause droopy eyelid. And then in certain cases where there's a sudden onset droopy eyelid, then you need to worry there may be something going on inside the brain, like aneurysms. Like in this patient, the patient has droopy eyelid because of tumor of the eyelid. And this obviously need to be corrected, otherwise it will spray into the brain. And then this is another patient who has sudden onset droopy eyelid, and then we examine the eye and find that the pupil is dilated, and immediately we ask for scan and find out that there's a tumor, not a tumor, lesions of the blood vessel which actually compress on the nerve. And the patient was referred to the neurosurgeons, which need urgent treatment to prevent the blood vessel from bursting, which can kill the patients.
okay, doctor,
Yes.
When a droopy eyelid develops, does it happen like overnight, or is it something that develops gradually? That means it just slowly lowers itself,
Mhm.
or something that happens, like swiftly.
It depends. If it's caused by contact lens, usually it happens over the year, slowly. But
Oh,
if it happens overnight, then we need to worry about something going on inside the brain, like in this patient with aneurysms inside the brain.
yeah.
So anything which happens suddenly, it need to be taken seriously. Yeah,
Okay, okay. So different paces lah. All right.
yeah. Depending on the causes, some of them can happen very fast. Some of them
Yeah.
slowly, like caused by the contact lens or tumor.
Yeah.
Mm.
But the one that's serious or the one that needs urgent attention is if suddenly you wake up and your
Yes,
eyelid is
absolutely. It cannot open. Then you need to
yeah.
see the doctor straight away to make sure there's nothing compressing on the nerve, which can be life-threatening, like in this case.
Mm.
Okay, I move on.
Okay. Yes, please.
Yeah. Okay. Causes of droopy eyelid. Here I illustrate the muscle which is the most important in opening the eyelid. This is the levator muscle.
Okay.
Droopy eyelid could be congenital, meaning that something you are born with, or acquired, occurring later in life. Congenital usually is caused by patient born with weak muscle that open the eyelid, and the patient need to be followed up to make sure they don't develop lazy eye. And if the eye is completely covered or the pupil is covered and the patient cannot see the light, then it's very important to do the surgery early so that the eye will have enough time uh, to function so that they don't develop lazy eye.
Lazy eye?
Yeah.
What is lazy eye?
Lazy eye is because as we develop, the eye needs visual input. If you don't have visual input into the eye, the retina and the nerve do not develop properly. That's why experiments show that if you have chicken or kitten kept in the dark uh, for a year or two, later on they become completely blind, even though when they're exposed to light later on, because there's no visual input for their eyes to develop.
Oh.
Yeah. Then there's acquired causes, meaning not born with, something developed later on. It could be because of detachment of muscle that open the eye, eyelid problem such as infection, inflammation, or tumor, or neurological causes. The most common one in the elderly is because of old age, because the muscle become weaker. And then, as we mentioned earlier, younger patients who develop droopy eyelid later on, the majority is caused by contact lens wear. Like these two patients who have droopy eyelid because of old age. And then these three patients are the result of wearing contact lenses. Then infection and tumor can cause droopy eyelid because you have infection or tumor. It make the eyelid heavy and make it difficult for the patient to open the eye, which is a mechanical effect. Like for instance, the patient on the left has an abscess, which stop the patient from opening. The one on the right develop a shingle, which because of the inflammation make it difficult for the patient to open the eye. Then there are various types of tumor which can also stop the eye from opening. Some of them are benign, some of them we call malignant, meaning it's cancerous. The one on the left-hand side is where actually have a cancer form of eyelid tumor. And the other three on the right and the bottom is a benign conditions. But because of the lumpiness of the tumor, the eye has difficulty in opening. Then there's neurological conditions. These are caused by nerve problem or due to neuromuscular problems. Compression of nerve that supply the muscle that open the eye, as I mentioned earlier, is an important cause, especially if the patient suddenly develop droopy eyelid, like in these patients. You can see that the patient not only develop droopy eyelid, but also have problem moving the eye. Then the other condition which can occur is conditions called myasthenia gravis. This is a muscle disorder which is made worse by exercise. This patient complained of right droopy eyelid, and when I get the patients to look up for about 1 minute, the droopiness get worse, as you can see, because with this condition, exercise actually made the droopy eyelid get worse.
How is it that exercise makes the eyelid droop more?
Oh, because in this
exercise.
in this condition,
Sorry, again?
myasthenia gravis is a condition where there's not enough signal between the muscle and the nerve. That's why if you get the patients to exercise, the muscle need to work extra hard. But because of these conditions, there's not enough signal firing, and the eyelid become more droopy.
I see. Okay, doctor, just now should have asked this earlier, because most of the pictures that we saw, it was only one side of the eye that was drooping. But how come? Is it just something that happens that when you get droopy eyelids, it's one eye?
Sometimes, like in contact lens wear, usually the droopiness is on both sides. But one side is more obvious than the others. Sometimes when we correct the droopy eyelid, the other eye become droopy. Yeah.
I see. Okay.
Yeah.
Like,
I go back to this one. Like this elderly patient on the left-hand side. You can see the right eye is droopy. Actually, the left eye is droopy as well. It's just that one side is more droopy than the others. Whereas the one on the other one actually have droopiness equally on both sides. And then these patients who wear contact lenses, as you can see, most of them has droopiness on both sides, but usually one more obvious than the others.
Okay.
Yeah.
All right. So where did you stop just now?
Yeah. Okay. I just talk about how droopy eyelid can be corrected. First of all, you need to know the cause, and the treatment should be tailored according to the cause. Like in this patient with shingle, the important thing is to get rid of the inflammations, give the patient antiviral, and then cream for the swelling. The picture on your right show that the eye is now starting to open after about 1 week of treatment. And this patient with abscess, obviously we drain the abscess and the patient can open the eye again. In patient who has weak muscle, this will obviously need to target the weaker muscle, and to choose the type of operation will depend on the power of the muscle. So to find out how much muscle power there is, we get the patient to look down, then look up to see how strong the muscle is. And only then we decide on the type of surgery. And the most common type is just where the patient's where the muscle become detached. We open up, find a detached muscle, pull it down, reattach it, and the eye will open up. That's the easiest. And these are 2 patients with contact lens related droopy eyelid. We did the operations. Find the muscle, pull it down, then the eye will open up. Okay, 2 more patients. We did the same. But in patient whose droopy eyelid is very severe and there's not much functions, then we have to use the muscle of the forehead to help the patients to open. And we normally put in a material to connect the muscle of the forehead together with the eyelid to help the eye open. Because when you move your forehead muscle, the eyelid will open up. In this case, this patient, we actually use the fascia latae, which is a muscle from the leg. We harvest it, then we put into the eyelid to help the patients to open the eye. Okay, like this patient before and after. Also before and after. Then tumor. With tumor, obviously you need to exercise and do reconstructions. If it's cancerous, then the patients will need special treatment by being referred to oncologists or radiotherapies. And these patients who has tumor of the eyelid, we have to remove the whole of the upper eyelid. Then we use the muscle from the lower lid to reconstruct. Then the patient went to see the radiotherapist and has some radiotherapy treatment.
This person looks very young, actually. Yeah.
Yeah. It's unfortunate. It's a condition called rhabdomyosarcoma.
Oh, I see. But this looks like a very advanced stage.
Yes, actually, the patient comes from Indonesia, and they
Oh,
did not
I
have
see.
treatment for many years.
I see. Okay.
And then this patient has this tumor. Actually, it's something that he was born with, and then it just get progressively bigger. So in this case, we don't need to do too much of the operation. We just excise the tumor, which is benign, and then do a bit of reconstructions. The one on the forehead, we didn't touch it because the parents said just make sure the patients can open the eye. That's all they want. This is a condition called neurofibromatosis, where you can get lots of lumpiness on the body. This patient happened to have one growing on the eyelid, so we need to excise it, do reconstructions, and the patients can open the eyes again. This is a benign condition, so no need for any further treatment. Then the neurological problem. The patient need to be referred to a neurologist or neurosurgeon, and they are either given medications or surgical treatment depending on the causes. Like for instance, this patient with myasthenia, we refer to a neurologist who did the blood test and the muscle test, which confirmed the diagnosis. And the patient was given this tablet and the eye opened again, so no need for any operation. Then this is a patient who suddenly developed droopy eyelid, and then scan showed there's aneurysms causing nerve compressions. This is an emergency, and the patient was referred to the neurosurgeon. And this is the aneurysm, and the neurosurgeon has to clip the aneurysms. Okay, so this is basically what I want to talk about droopy eyelid. So important of droopy eyelid is not just aesthetic, but can affect visions, and it may be related to serious conditions such as eyelid tumor or neurological conditions. But the good news is majority of droopy eyelids are treatable. Thank you.
That's good to know. That's good to know. Okay, doctor, some questions. What is the age range of the patients that you normally see who come in with let's say about the contact lens related droopy eyelids?
Most of them will be in their late 20s to I would say between late 20s to about 40 years old. Because after 40 years old, they'll have problem wearing contact lenses because they have what we say presbyopia, problem with reading. Then they find that it's easier for them to wear glasses rather than contact lenses.
Yeah, that you did say much earlier just now that droopy eyelids is quite common, and then the most common reason for droopy eyelid is wearing contact lenses.
In young adults, yes, that's the most common.
Yeah. Generally, what would be the common cause of droopy eyelids?
As I mentioned, the majority, most of them are treated contact lens related, followed by congenital, something born with in children. Yeah.
Right.
Those are the two main groups.
Okay. All right. Okay. So there's no really particular patient profile because all the causes are different.
Yeah, that's right. Most of them are because of droopy eyelid as a result of weak muscle. Yeah.
Yes. Okay. Let's see if we've got any questions. Oh, okay. We do have Mr. Bajish Paul giving a thumbs up to you. Okay, he's our regular. Okay. Other than this, how can about droopy eyelids? I'll just share an experience since we're still waiting for questions to come in. My father had myasthenia gravis, and it all started. I mentioned earlier to you before we started talking, right? Because the first thing that happened was actually his eyelid drooped. So we thought at first it had to do with his vision.
Yes.
But it turned out to be lymphoma, which was cancer. So I don't know how that came to be. I just thought I'd mention it to you since
Yeah.
we are on the subject of.
Yeah, but sometimes you get lymphoma inside the orbit, which are not very obvious at the beginning. Unless you do a scan, then only then you can see the lymphoma. Actually, lymphoma inside the orbit can actually cause droopy eyelid.
Oh, I see.
Yeah.
I see.
But for myasthenia, just now I mentioned, most of them will be treated with medications. But some patients, they cannot tolerate the medications because they get diarrhea and things like that. They find that the medications just to help them to open the eye is not worth it. Then they'll do surgery to help them to open the eye. But most of the time, we advise them to take the medicine if they can tolerate that.
If it goes to the extent of surgery, is that sorry, there's a thunder and lightning happening here where in KL. Oh, Prof. Dr. Chua is actually in Kuching.
Yeah, that's right.
If you're wondering where he is, it's not Miri or Bintulu, he's in Kuching. But he practices at Miri and Bintulu, so you can find him there at Colombia Asia. About the if you were going to do surgery on a patient with droopy eyelids, how long after would the patient be discharged from the hospital? Just trying to see whether how serious, how big of a surgery is this?
Okay. I would say that if the droopy eyelid is caused by contact lens, then the surgery probably take about 10 minutes per eye. Because I do it from the back of the eye, that one is quite fast. About 10 minutes. After the surgery, I'll patch the eye for about 1 hour. Then after that, we remove the patch, ask the patients to apply ice compress for 2 days, normally every 2 hours, each time for about 10 minutes. Then we give them some eye drops, then they can go home.
So it's a day procedure. You don't have to be admitted.
For adult, yeah, it's a day procedure. But for children, obviously, they need to be under general anesthetic.
Yeah.
The majority of children with ptosis, because the muscle is very weak, and we need what we call the frontalis suspensions. If we use the synthetic material without having to use the leg muscle, then one will probably take about 15 to 20 minutes. But if we need to harvest the leg muscle to do it, probably take about 40 minutes. Once the patient recover, they can go home as well, as long as the anesthetists are happy.
Yeah, you're saying that for the children, you need to they need to go under general anesthetic, but for adults, it's local anesthetic.
Unless they are really frightened, but we try not to do general anesthetic in adult. If they're really worried, we normally give them a bit of sedative. Yeah.
Yeah, because of course, I mean, from the
yes, and also for adults, when we do this surgery, we want to make sure the two eyes are balanced, so that during the operation they can open the eyes and we can check both eyes are balanced.
Oh, yeah. I see. So you would need some input also from the patient as you are doing the procedure, lah. I see. Okay. It's just like from a layman's point of view, when we were looking at the pictures just now, it was quite scary, lah. You know, we were looking at eyelids.
But the operation is very fast, and then it's completely painless. We give very good anesthesia.
Wow. I see. Okay, well, it does sound like a very simple procedure from the way you described it.
Actually, the worst part of the operation is during the injections. They find that the pinprick from the injection is the worst part. After that, during the surgery, they don't feel anything.
But after, when they go home, will it hurt when the patient goes home?
Usually, I give them ice compress, and I tell them that if they find it painful, they can take some Panadol, but most of them don't find it so painful. They just apply the ice compress, cool down the wound, then the eye is comfortable.
Once they are finished with that, and as they are recuperating, what are some of the things that they are not allowed to do in order for the eyelid to heal properly?
Well, normally we will give them eye drop and then cream, and then we have advised them not to do vigorous exercise in case the wound break open. If they're ready to exercise, they can go strolling, but avoid swimming, avoid jogging or heavy lifting for about a week. After that, should be okay.
I think you must have heard the thunder.
Yeah.
Okay. So how's the weather there in Kuching since we're on the subject?
Oh, quite sunny. A bit cloudy, but sunny.
Okay, that's nice. That's nice. Okay, I think we're about to wrap up the session today. But is there anything else that you would like to tell people? I think mostly contact lens wearers lah, since a lot of people are still
Yes.
using contact
The
lenses.
important thing is in children with droopy eyelid, the parents need to be worried. It's important to bring them to have the eye check in case they develop lazy eye. And patients who develop droopy eyelid suddenly need to see the doctor immediately in case it's something serious going on inside the brain.
All right, so there you go.
The rest patients will wait.
Yes, of course. So, ladies and gentlemen, if you have children, and if you see that there's a droopy eyelid situation going on, or if you yourself or you know anyone, family or friends who have droopy eyelids, you can always see Professor Dr. Chua Chung Nen from Columbia Asia Hospital, Miri, and you can also find him at Columbia Asia Hospital, Bintulu. All you need to do is go to our website www.columbiaasia.com, and the Bintulu and Miri phone numbers will be there. All the information. Okay. So thank you so much, Dr. Chua. It was really nice talking to you.
Thank you. Yeah.
Thank you. Thank you, everyone.
Bye bye.
Bye. See you again. Take care.
See you.